$250 million of cost at least, and that's about 1% to 2% of their profit. So the fact that they're getting to healthcare, that they've been frustrated with the way it's worked for so long, and they're going to bring some of their know-how to try and disrupt this industry, it doesn't surprise me at all.
Zach, what more details do we have about how exactly this will work?
You know, the really interesting thing is that we just don't know that much about how this is going to work. What we know is that Berkshire Hathaway, JP Morgan, and of course Amazon are teaming up, essentially to take on healthcare, to take on this really big cost, like Steve pointed out. They say that they're, going to look at transparency, look at doing some stuff digitally to, bring down costs or to provide care to their employees. But it remains to be seen, does this mean that they're going to try to kind of, replace some of the middlemen in the system, some of the folks who provide insurance now or drug benefits now? Certainly investors are concerned about it, but we just don't know yet.
Jamie Dimon saying the three of our companies have extraordinary resources, and our goal is to create solutions that benefit our U.S. employees, their families, and potentially all Americans. Warren Buffett saying the ballooning costs of healthcare act as a hungry tapeworm on the American economy. Our group does not come to this problem with answers, but we also do not accept it as inevitable. Rather, we share the belief that putting our collective resources behind the country's best talent can, in time, check the rise in health costs while concurrently enhancing patient satisfaction and outcomes. Steve, what kind of challenges are they going to run into?
Yeah, well, I think this is a classic buy versus build decision for them. They've been buying this for so long. As Zach said, there's been intermediaries, insurance companies, pharmacy benefit managers who have been trying to do this for these companies for a long time. And today, not surprising, their stocks are down significantly, anywhere from 4% to 6%. Companies like United Health, CVS, Express Scripts have been hit. I think Amazon and JP Morgan and Berkshire are going to try to build this. And so two things they need to do. One is that they actually need to build direct relationships with healthcare systems and with providers. They need to do direct contracting, because that's actually where a lot of the cost is. The cost of healthcare is actually care itself, and so they need to get down into where care is provided and develop those contracts. That's not an easy thing to do. Secondly, they need to bring the know-how that they have around engaging with the consumer, around paying. That's obviously where JP Morgan comes in. They have expertise in payment rails, around underwriting risk, right? It's you're talking about a broad population. You have to underwrite their healthcare risk and healthcare costs. That's obviously where Berkshire Hathaway comes in. And then Amazon comes in with the consumer engagement know-how and, frankly, the analytics and the data science around segmenting a population according to their risk and how healthy or not healthy they are. So I think they've got a lot of road to hoe. There's a lot of wood to chop, but frankly, I think a company like Amazon, they've proven to take down, as you showed earlier in your segment, almost every single industry. The healthcare economy is 18% of GDP. I don't see why they wouldn't start attacking this industry and really disrupting it.
Right. How much could this actually threaten the incumbents and industry standards? I mean, they're going to be offering this to their employees initially, but the goal, could potentially be, other customers across the United States. How much could this actually change the industry?
Well, investors are saying this threat is real. Take this seriously. Whether that's, a threat to, United Health or the big health insurers, Cigna, Anthem, down quite a bit today, or the pharmacy supply chain, is still not clear. But, I think that what these companies are going to discover as they move through this is, like Steve pointed out, some things that they're going to want to build, they're going to want to do themselves. And some things they may say, you know what, we'll let United Health handle that, or we'll let CVS handle that, because, they're better at it, they can do it at scale. But, the mix remains to be seen, and I think that's why people are so nervous today.
Steve, will this be impacting or changing any of your investment decisions?
Oh, yeah, for sure. I mean, any venture capitalist will tell you they always think about Amazon, and now that's true for healthcare. I think from the macro perspective, frankly, the healthcare IT market has had a lot of venture capital poured into it, probably $20 to $30 billion over the last 5 years. There actually haven't been a ton of public offerings, only one last year. And I think I've always said that when the big boys, when Apple, when Google, when Amazon get into the industry, that's going to be a bellwether moment and a tipping point, because you're going to see real tech strategic interest in this space. So I think on the macro perspective, it's going to affect the market. And I think for companies that are focusing on consumer, on actually drug costs, on the underlying cost of healthcare, any startup that's focusing in that area, as Zach said, these companies are going to build some of the things on their own, and then they're going to buy some things. And they might buy them from the large incumbents, but they might also buy them from the startups that have been focusing on building these innovative technologies for some time now in healthcare.
All right, Steve Krause, Bessemer Venture Partners, thank you, as well as Zach Tracer, who covers healthcare for us. Thank you both. We'll have much more reaction on today's news later this hour. Coming up, Waymo ramps up its ride-hailing plans for it.
I'm Charlie Atkinson, president and founder of the Whole Brain Foundation and of Whole Systems International Corporation here in Cambridge, Massachusetts. It's 10 hours and counting since I first learned about the Amazon, Berkshire Hathaway, JP Morgan collaboration to disrupt the whole connected health system. Here at the Whole Brain Foundation, we've been doing the research using the whole brain 3D visual framework of the mind to enable consumers to have a new three-dimensional framework that helps them store memories, organize platforms, and quite importantly, integrates the applied creative problem-solving process on how to solve health problems. We're building a complex, integrated system that takes new information from research, diagnoses, and curates what health is, that diagnoses health, not disease, so that even the youngest people in the healthcare system will be willing to pay to take personal responsibility for their personal health competencies to get a service that helps people from cradle to grave lead the happy, healthy lives worth living that the good Lord and good technology and good science and good humanity can make possible. So I urge that we all join together in taking our first step. The first step that we're taking is a proposal now to Marshal Van Alstyne, a professor of information technology at Boston University, who has written, with others, an important book on the platform revolution. And we are well, I dropped the ball, but I picked up the ball. I picked up my iPhone 10, and I'm continuing to march. We are proposing to be one of the platforms that Marshal Van Alstyne's team of students will work on in the spring term of 2018, with a decision coming on February 7th, 2018. There are 17 proposals under consideration. We may be the smallest organization with the biggest idea and the fastest moving of any of the 17, which includes groups like Siemens, for example. The other players, the other professors at Boston University, including Paul McManus, who, working with G. Gordon Bell and High Tech Ventures and Heidi, built a framework based on the two-dimensional whole brain model to organize the dimensions of of a high-tech venture around the clock from in the upper right, at 1 o'clock marketing, 2 o'clock sales, 3 o'clock the entrepreneur, 4 o'clock the team, 5 o'clock the board, 6 o'clock cash, 7 o'clock accounting, 8 o'clock may have been control, 9 o'clock the product, 10 o'clock the delivery, the development, 11 o'clock the delivery, and 12 o'clock the strategic plan. That model, using a clock metaphor, is the same metaphor we've used to apply to personal health competencies, where let's start out at 1 o'clock is learning and working. 2 o'clock is playing and partying. 3 o'clock is thinking and loving, the whole emotional dimension. 4 o'clock is exercise. 5 o'clock is sleeping. 6 o'clock is nutrition, dieting. 7 o'clock is speaking and swallowing. 8 o'clock is looking and feeling. 9 o'clock is your heart beating, all the organs breathing and beating. 10 o'clock is spending and power. 11 o'clock is tools and technology. And 12 o'clock is your destiny, going away and coming home. So we are using these simple, symmetrical, standardized, shareable, systematic frameworks in our city of which I call Charlie's conceptual cube, based on Charlie's conceptual cube, but it also maps to the brain, left and right, cerebral to limbic, back of the brain of the occipital lobe out to the prefrontal cortex. It maps to New York City, 59th Street and 5th Avenue, right there on that intersection in Manhattan. But importantly, when you build up the clusters of the cubes and become Charlie's conceptual city, and therefore CCC, the CCC will map to the World Wide Web, www, and will connect the whole shebang, not with a gadget, not with a gizmo, but with a whizmo. So here we are, hoping that we get good news from Marshal Van Alstyne's team, and we're going to be counting the days. It's now January 30th at 6:30 p.m. And we're going to watch the evening news. But we've got tomorrow. We've got eight more days, and we're gonna be praying, and we're asking all of the people in our audience, from Paul McManus to Professor Venkat and his digital matrix, to Hugh O'Donnell, professor in the School of Visual Arts in the College of Fine Arts at Boston University, who has, with his student, Heo Kang, living now in New Jersey and originally from Korea. We are building the whole connected health system with a 3D, whole brain 3D framework for the mind as the second Manhattan Project to enrich your cranium. Join us and help us spread the word that we need those students. We'll go from the BU students to Harvard students at the Gates and Balmer School of Engineering and Applied Science. We'll work with the Innovation Center at Harvard, with the Media Lab at MIT, with MGH, with the Boston Globe. But it all comes down to an integrated effort of the Whole Brain Foundation, Whole Systems International Corporation. We'll work with IBM and Watson. We'll work with GE and Edison. We'll work with